You're on the estrogen patch and progesterone and got a blood clot after a long flight. Was it the hormones? Hi, I'm Chair. I'm a pharmacist, and let's see what science says about it. Long flights, especially over 4 to 6 hours, can increase your risk of a blood clot. This is also called DVT, or a deep vein thrombosis. That's a clot that forms in a deep vein, usually in your leg. It happens because you're sitting still for hours and blood pools in your legs, and the cabin pressure and lower oxygen levels don't help either. The risk goes up by 18% for every extra 2 hours of flight time. Did the hormones play a role in this case? Evidence suggests that not all hormone therapy is the same when it comes to clot risk. Oral estrogen, the pill form, goes through your liver first and ramps up clotting factors. That raises your DVT risk. But transdermal estrogen, that is the patch, gel, or spray, bypass the liver. Multiple large studies show that your risk for developing a blood clot while using transdermal estrogen is about the same as women who are not on hormone therapy. Micronized progesterone, the body identical kind, also appears to be neutral when it comes to clots. It does not activate the clotting system the way synthetic progestins like medroxyprogesterone acetate do. So the combination of the estrogen patch plus micronized progesterone is considered the safest hormone therapy option from a clot standpoint. So why did you get a clot? If your hormones probably weren't the main driver, what was? Prolonged immobility is the biggest risk factor for travel-related DVT. Add things like living in a large body, a window seat, dehydration, a previous clot, or genetic clotting condition like factor V Leiden, and the risk stacks up. Your doctor may want to test you for an underlying clotting disorder, especially if this was your first clot. Treatment for travel-related DVT is with a blood thinner, usually for about 3 months. So how do we prevent this next time? For future long flights, here's what the evidence supports. Wear compression stockings, 15 to 30 millimeters at the ankle. These are the only prevention method actually proven in clinical trials for travelers. Get up and walk the aisle for a few minutes every 1 to 2 hours. Do calf pumps and ankle circles while seated. If possible, book an aisle seat so you can move freely, and stay hydrated. Also, talk to your doctor before flying. In some high-risk cases, a single dose of a blood thinner like enoxaparin before flight may be recommended.